Hello students, in drug and dyes, the last lecture in the last lecture we have studied the narcotics drugs, non-narcotics drugs, histaminic drugs, N-aryl anthranidic acid, cardiovascular drugs and atenolol. Atenolol is the cardiovascular drug used in the treatment of generally the cardiac heartbeat, and that is in the blood pressures. The structure of atenolol is given here. Use is that it is a beta blocker, that is it is selectively blocks beta receptors present in the heart. So we are dealing with the atenolol. Atenolol is a beta blocker, that is it selectively blocks beta receptor present in the heart. It is used in the treatment of angina pectoris and also myocardial infections. Explain the term respiratory stimulants. Respiratory stimulants are dealing with the respiratory tract, respiratory systems. In the respiratory systems, lungs, respiratory tracts, nose, throat, and esophagus, these parts are comes. We respirations perform two methods. One is the inhalation and another one is the exhalations. In the inhalations, we inhale the oxygen from the atmosphere, which is required to perform the various body activity, and it is very important for the survival of the life and for the metabolisms and cellular life. Another is the exhalations. Exhalation is the process in which the already prepared carbon dioxide, that is cell product, it's exhaled from the body in the form of CO2. So inhalation required O2, exhalation required CO2. It is the process. While performing this process, the lungs are a very important key, and in the lungs there are branches like structure having the alveoli of lungs that exchange the gases, that exchange the oxygen and carbon dioxides. Sometimes the problems are created on the alveoli of the lungs, and that parts create the respiration problems. Means in the asthmatic patients, in the cough patients, at that time the alveoli of lungs not performing properly, their sides are blocked. In the asthmatic patient or severe asthmatic patient, or in case of the COVID-19 patients, generally what happen, this part, that is alveoli of the lungs, are blocked by the sticky materials, and that sticky material opposes to take inhale or exhale, means there is more and more difficulty for the respirations, and patients goes on the ventilator and after the ventilation there will be death if not condition covered. So this is the important system. And now COVID-19 situations, total focus on the respiratory systems. Doctors are advised to improve the immunity power so that you are be safe from these viral infections like this cold, cough, fevers, all these things. So it is all deals with the respiratory systems. These drugs stimulate the output of the respiratory tract fluid either directly or by the reflex actions. Hence they are of two types, that is the direct stimulations and indirect stimulants. Certain volatile oils like oil of eucalyptus, anise, lemon, cedarwood as well as alcohol, when administered by the inhalation with the steam, can increase the secretion in the respiratory tract. Reflex stimulants. These drugs produce mild irritations of the gastric mucosa, thereby stimulating the gastric reflexes with the help to increase the respiratory tract secretions. Example: lemon, ginger, tea, coffee, which contain the caffeine and theophylline. What is the Parkinson diseases? Give its two symptoms. In this, we are focusing on the only important questions because it is as it is applied papers. We are giving some hints and some instructions so that this part will be covered, and definitely we will help you to improve your scoring in the drug and dyes. So the friends, don't be take attention about the drug and dyes. What is the Parkinson disease? Give its two symptoms. It is disease named after Dr. James Parkinson. Parkinson disease is due to the abnormality of the central nervous system and the malfunction of the lower part of the brain. It mainly causes the rigidity in the body, affect the posture, movement and the speech. There are three types of Parkinson diseases: idiopathic paralysis, agitans, potentiophthalmic Parkinsonism, arteriosclerotic Parkinson. Symptoms: tremors is the most visible symptom of this disease. It occurs at the wrist and is the most common in the hands and arms. As the disease progresses, the tremor may affect the more of the body and more become more pronounced. Rigidity or muscle stiffness results from a shortening of muscles. This rigidity causes unstable posture and awkward gait. This results in a movement of the limbs. In acute condition, the facial muscles freeze, resulting in the mask-like facial expressions. What is diabetes mellitus? Next question is diabetes mellitus. How it is related to the insulin? So the friends, this is the next part we will cover in the next lecture. Please revise the total parts which we have covered. Focus on the practice of the organic chemistry, because organic chemistry is the practicing chemistry. You do practice continuously until the mind develop in your hand. Until then you can say that I have covered the organic chemistry. Otherwise you cannot say that okay, you have covered the organic chemistry. You need a practice and practice. Okay friends, cover all this part, revise regularly, focus on the study, give some times your times, whole day's time for the study. Increase your knowledge about the other things, because it is at your best times. You cannot get this time again in the future, so to improve your skills. Okay, thank you very much.